And then are you just kind of randomly going to other places, or do you know what things are kind of connected to each other?
Yeah, I mean, that's where like the FM stuff comes in, clinical experience comes in. The idea of fascia was just a throwaway topic, right? Like you kind of knew what it was, but you cut it away and you moved on to the next thing. So it was all like, all passion project basically of like educating myself and finding the right people to learn from that I can make sense of, like how to help someone. That always drove me crazy because I'd been a patient before too. And it's like, I understand my knee hurts, but like, why does it hurt in the first place, right? It's stable. There's no tear. Like, why does it hurt in the first place? And so that's what led me down, like chasing down this whole rabbit hole of fascia.
Welcome to Only the Greatest Podcast. If you're feeling stuck and unsure what to do next in your fitness journey, we might be what you're looking for. My name is Philip. I own and operate OTG Fitness, which is a private personal training gym on the south side of Houston in Webster. I do this podcast every week with my best friend, Daryl. We've been friends since third grade and working out together ever since. Also joining us today will be Sean. He's the one that makes this podcast not only sound great, but look good as well. Our goal here is to help Houston make its way up the ladder of health and fitness. So if you're in the Houston area and ready to become the greatest version of yourself, be sure to like and subscribe on your favorite podcast platform.
Yeah. Uncle Sean says we're good. Phil, do you want to bring it in?
Does anybody have any questions or
I think we're going to ask them.
Okay, perfect. Well, let's bring this thing in then. You want to get us started? Or we always struggle with this.
We always struggle with the new intro.
Yeah.
Well, we have the new intro, so we don't have to do.
We don't have to do an intro anymore. So, like, how do we get started?
Sean, make this discussion the intro.
We're in it.
Okay.
So we're started now.
Yeah, we are.
All right. Okay, perfect.
Welcome to the podcast.
This is the OTG podcast.
Welcome.
Yeah.
Well, we have Frank here, and Frank, just want to say thanks for everything that you've helped me with. I've known you for a couple of years now, and you've really taught me a lot. I've learned a lot from you. We have great conversations, and I hope that we can really bring some value into what we're doing, or into the conversation today. I learned a lot yesterday. I went to Frank's yesterday, and I'm going back in a couple of weeks, and I already told Sean that we're going to come by. So maybe if we can book that when you have a little bit extra time.
Sure.
We're going to film it. I got my whole right leg dry needled from the top of the quad into my big toe. And it was rough. I was like sitting there. I was like,
Painful?
just relax. Painful is not the right word.
Like
you know what it was? There was a part of it that I'm sure he was uncomfortable with during session.
Right.
But it was, he was definitely having a sympathetic response.
Oh.
When he got off table, it was drenched in sweat.
Yeah, it was. Yes.
So that means whatever we're doing was just heightened to another degree on top of, right?
Yeah, and pain is not the right word, but uncomfortable is a good word.
Well, you know what it is it's two things. It's we are targeting those tissues for a specific reason, and it's because they're dysfunctional. Yeah. And then two, you are consciously aware something foreign is right now in my quad.
Yes.
Right.
Yeah.
And so it's like it doesn't quite hurt, but it's it's not supposed to be there.
Yeah, and you don't notice until when he pulls them out because they're so small, you don't really notice it. But when he pulls them out, you feel how long it takes to pull out, and you're like, "Oh shit, that thing was like in there pretty deep, like a solid inch or so." I mean, I don't know exactly because I was not watching, but it
because I was unconscious. I just passed out at this point.
I was dead.
But usually, like it's funny because like I'll have people who are like all tatted up, and they are just like super like nervous about getting anywhere near a needle. And then usually it's like if you just like focus on the fundamentals, talk about kids, talk about family, it's like, wow, we're done already, and it's not such a big issue.
Dude, you'll be surprised. My wife has a few tattoos, and we went to give blood one time, and they prick your finger to check your iron. passed out. When they used a little tool to prick her finger so that they could get the little strip. She literally fell out on the ground.
Oh, no.
So anyway, yeah.
Oh man. Well, yeah. We are going to talk about dry needling a little bit, probably. Or go ahead.
Funny, I was gonna bring
the mic a little bit.
I was gonna bring this in. Yeah. I was gonna bring this in by saying a little bit of a funny story on how I guess changed the agenda. We were just talking about it off camera. So Phil, go ahead and say what you sent to Frank, and then we'll go. That
is a good way. So we were trying to come up with a topic of conversation for today to bring some good value. Frank is very knowledgeable, so we were trying to dial in. And he mentioned fascia. I was like, oh man, that's a good topic. You know, I talk to clients sometimes about fascia, and you know, because we talk about foam rolling and recovery when you have knots and aches, pain, stuff like that. So I type up a quick agenda, make a title, and I send it over to Frank for a review. And what I had come up with is like, what is muscle fascia or muscle fascia explained? And Frank's like, well, muscle and fascia are different things, so we can start by changing the title.
We'll change the whole title.
I was like, well, all right.
The whole thing.
You were immediately wrong.
Yeah,
that's why we're here, man.
Yeah,
like let's break down barriers. Let's get people thinking about their bodies differently.
Yes,
and that leads to a whole cascade of like just good movement, good health, good long-term support.
Yeah, because I've always thought of, and we'll start here by just straight up correct what I'm saying wrong.
So
I've always thought of muscle, and I don't know about you, Daryl, because Sean wasn't real familiar, but I've always thought of fascia as part of the muscle. It's like the muscle fascia, the outermost kind of layer thing.
That's what I thought too.
And
me too.
Yeah, so fascia basically is everywhere in your body. So it will cover muscle, it will cover organs, it's in the joint spaces. So this is the loose network that basically supports all of your body. And so, maybe if you've dissected it out or you've seen it like in a lab, right? Like it makes sense. Like you're like, okay, this is that outer layer that, is kind of shiny that we're cutting away, right? We're tossing it away. That's actually like why it was so misunderstood for so long, because fascia, it's the stuff that you would cut out to start getting into the nitty gritty of, organs and muscles.
Yeah.
And so it wasn't until they started actually saying, well, why is this everywhere that we're looking in the body? And so that's where they started like looking at it in a deeper dive. It started understanding how it influences the body on a different level. But yeah, for the longest time, researchers just kind of thought it was just like gross connective tissue that, served no purpose.
Right.
And now it's like the opposite end. They're understanding it's more intricate, plays a role in the nervous system, it plays a role in pain, it plays a role in movement. And so, yeah, just if you just imagine it's the network of your entire body, though.
I'm picturing sixth grade science class. We're dissecting the frog in Miss Clark's science class.
Shout out Miss Clark.
We cut, you cut the stomach of the frog, and then there's this layer that she's like, all right, now you're going to cut that little thin piece, and you're opening it up, and then you see all the organs. Is that accurate?
Yeah. So yes and no, right?
Okay.
So if you think about you're cutting into the frog, right? Like you're going to have to cut through top layer of tissue, right? Mm-hmm. So this is where we think about like the skin. Underneath the skin will be a layer of, fatty tissue. And then you're going to have 2 layers of superficial fascia. Underneath that is more connective tissue. And then there's going to be a deep layer of fascia that technically is 3 layers deep. Okay. And then you're going to get to the muscle or the organ, right? So, and then even the organs themselves can be covered in more fascia. And so, but the orientation though is, superficial to deep. Before you get into the muscle, it's going to be, skin, adipose tissue, fatty tissue to insulate the body, superficial fascia, more connective tissue, deep fascia. And this is where, when you think about the bigger picture of how they like interact with each other, it actually makes a whole lot of sense. How these things kind of like add up, like little problems add up to bigger problems down the road.
Yeah, I'm kind of picturing, and correct me if I'm wrong, Frank, I'm kind of picturing the, you called it the network, and it kind of got my brain thinking about it. I'm picturing it as maybe like the, how do I say it? Like the casing that holds everything together.
Yep.
And it, like, if it goes away, we would fall into different pieces, perhaps.
Kind of reminds me of sausage casing.
Yeah,
Like a sausage casing.
You can think of it like sausage casing, but its role is more important than just providing structure for the tissue, right?
But it does. Is that one function?
Yes.
Oh, okay. So that would be one function. All right.
Sure.
Cool.
Yeah, and that's why they kind of dismissed it for the longest time, because it was just like, oh, okay, like let's cut through this and let's get into other things and look at other things under the microscope.
Yeah.
But it was only until like they were finding it everywhere in the body, and they were like, okay, why? Like, why is this everywhere in the body? What is its role?
Must
what is
be
its
more
purpose?
to it. Mm-hmm. Super cool. So, what happens whenever the fascia is unhealthy? Or what's the difference what makes it unhealthy and what happens when it is?
Yeah. So if you think about the fascia, we already kind of talked about the different layers. Mm-hmm. Now, if you looked at it underneath the microscope, if you just looked at it under a microscope, it would at first look like it's disorganized. Mm-hmm. Okay. Like it's just random tissue being laid down. But what they realized is, if they started to dissect and separate it out, that it's actually like organized. It looks disorganized until they start separating it out. And then they realize that it's actually moving in different planes of motion.
Okay.
And so this is where it helps transmit stress from one part of the body to the other, or communicate from one part of the body to the other.
That makes perfect
and
sense.
So
multi-directional.
Because even if we're running, right, you guys are getting ready for the race, right?
Yeah.
You're running forward to the finish line, but you're moving in 3D space. So it's not just front to back, sagittal plane. You're rotating in 3D space, and that means that your body has to process that information. Part of that process is fascia sliding and gliding amongst or against each other freely to produce efficient movement. And so, in a perfect world, right, like that fascia will move freely as many different directions as it's supposed to, so that you can perform at your best, right? But if there's dysfunction, all of a sudden there's a kink in the chain.
Okay.
And that kink is, in theory, the starting point of cascade effect towards, unhealthy fascia or worst case scenario injury.
Yeah.
And so back to like what exactly it is fascia from an organ perspective, fascia to the skin perspective, fascia to a skeletal muscle perspective. Are each one of those different? Are they all the same? Do they have different layers?
It's all going to be the same. What happens is in between the layers, this is where it's super important, okay? In between the layers, there's a hyaluron, and hyaluron plays a role in lubricating in between the different layers. And so when hyaluron's happy, it's gonna attract water to it. Mm-hmm. That way it acts as a lubricant throughout any part that it's supposed to. So basically what it does is it fills in the space and it helps lubricate so that there's free movement, right? When it's unhappy, it starts to repel water. And so instead of it being moving freely like lubricant, it starts to congeal almost like a thick soup, right? And so what will happen is naturally it'll start to compress and approximate towards each other. And then the other thing is the hyaluron will cascade. If one of them's unhappy, it'll start telling everyone around it to be depressed. Okay. And so what you end up having is like this cascade effect where now everywhere around that starts to be affected, and it's a bigger and bigger cascade to where now there's less slide and glide. Now there's less space in between the slide and glide to happen.
So. And on you're saying that it feels bad, it's unhealthy, and it starts to spread. You mentioned that in Daryl's reference of like sausage, or Sean's reference of sausage casing. Mm-hmm. That's one of the things that it does. So obviously when it's quote unquote unhealthy, this casing is not doing as good of a job as it could be. But what other functions is our body relying on due to the fascia? Like what else is the fascia doing?
Yeah.
And then we can talk about like what happens in a negative manner for all these functions that are related to the fascia.
Yeah. So think of it like this exists everywhere in the body, and we're thinking about it in terms of movement, right? But the reality is within all those different layers, there's still, arteries, veins, there's nerves, free nerve endings.
Tendons, I'm sure.
Tendons, ligaments. we think about like the big nerves, right? Whenever we think about pain, but the reality is, the free nerve endings, any of the sensors on the free nerve ending receptors, all of that's information driven to your brain to give an idea about how healthy or how unhealthy something is functioning. And so when we think about fascia, we should be thinking about, do we have an optimal environment for the rest of the body to do its job? Mm-hmm. And so, we deal in our office specifically with movement-based problems, but it doesn't mean that it couldn't apply to other areas of the way that your body moves or performs.
Okay.
Does that make sense?
So I'm envisioning a unhealthy fascia. As far from a movement perspective, it could limit mobility and performance, ultimately cause some type of imbalance, and then worst case scenario, you can get an injury, right? Because your fascia is not.
That's like the chain of events that's following, is what you're saying.
Yeah.
Right?
So I always draw this out. I'm like the worst drawer.
Nah, Frank's a great artist. You should see his whiteboard.
But it's always on the whiteboard. But we work off of the I3 model, and it's pretty simple. Because if we think about unhealthy fascia, you can think of some of the obvious things like a true injury. Hey, I went running, I twisted my foot in a pothole. There's some sort of trauma involved, right? Or, hey, like I had surgery, I haven't moved my shoulder in months. There's immobilization involved. You would kind of understand like there are specific structures involved that need to be addressed. If we're thinking about fascia in a movement perspective that's unhealthy, the cascade for the things that aren't quite obvious start off always with incomplete mechanics.
Okay.
And so this is going to be like a lack of range of motion, lack of control. Like maybe you move well, but you just don't control that movement.
Right.
And then, if those things are in place, what ends up happening is it leads you to the possibility of having an incident. And the incident is where it's like, oh, okay, like I worked out, but I tweaked my back, right? Now I laid off the weights for like 2 or 3 days, did some homework, quieted down, and now I'm back into the gym. The problem with that is, the body will adapt, but if you have, poor movement or compensation movements, right, over time, that incident will keep happening again and again and again. The body will do something poorly, 1,000 times, maybe 100,000 times, but one time too many, and it will say, no, we're never going to do this again. And that's where you fall into like the injury.
Yeah.
I had a kindergarten teacher who was a power lifter, and he came in to see me because he bent over to grab his sandwich that was in his lunch bag on the floor.
Oh, man.
And he said, I tweaked my back, and it hurts, and I don't know what's going on. And so I told him, do you think, that you hurt your back grabbing a sandwich? Like, you're used to lifting heavy things.
Hey, that might have been a big one.
I think I need this sandwich.
Like a double meat, triple meat, triple cheese or something. Anyway.
Yeah, but like the idea though is like it wasn't the sandwich, right?
Right.
It was the 1001th time that he bent over and lifted something poorly, right? That the body said, nope, we can't do this anymore. Yeah. And so, it's usually a cumulative effect though. The easy stuff to figure out is like, hey, like, I fell down and I hurt this, right? Like there's a clear like connection for that. I think the tricky part, and I think clinicians it's not that they don't care. I just don't think that they understand how to look deeper for like root cause stuff.
Okay. Super cool. So let's roll into the next little topic here. How do we keep it healthy? How do we keep our fascia healthy? Other than, I'm going to assume some good stretching before, making sure that we're moving in a balanced way, right? We're not favoring a certain side. Sure. But I'm gonna let you talk more in depth.
And I just want to, and obviously you explained, but I want to look at this from 2 different perspectives. When keeping it healthy is being proactive.
Yep.
And then you just spent 10 minutes talking about injured, which would be a reactive situation, but we want to get back to healthy. So can we kind of maybe approach this question that Daryl's asking from I'm healthy now and I want to stay that way?
Sure.
Versus an injury perspective where I'm trying to get back to healthy. It kind of 2 different situations. Maybe
versus professional help, self-help versus professional help.
No, not necessarily. Just saying, I want to stay proactive. Somebody's listening to this. They're not hurt. No injuries. I feel good in the gym, but I want to make sure I don't get hurt.
Yeah. Okay.
That's proactive, right? And now let's also think about it from a perspective of, hamstring's been a little tweaky for doing some squats the other day, my hamstring, just something doesn't quite feel right. So like these are two different situations going on here, right? But as we're talking about what keeps it healthy, can we maybe look at it from both those perspectives?
Yeah. So remember we were talking about how hyaluron will kind of congregate with each other, and now there's a kink in the slide and glide system, right? Okay. So it's pretty interesting because, all it takes is for us to start to wear down and break down one of the kinks, and then the cascade effect happens again in the opposite direction, where it's almost like tempered glass. Like if you just hit tempered glass once, all of a sudden it's this spray effect, right? It's the same idea with the hyaluron once it kinks. And so this is where being proactive, you'd want to think about staying ahead of the curve, managing fascia, soft tissue before the kinks develop. But if you notice that you do have kinks, then this is where you can't just ignore it and hope for the best, right? Like you address it, and then you come back and you assess it again, and then you address it again. And so if we think about like tissue, like if I, push into my arm or my forearm, it should have some bounce, should have some give, should not say ouch, right? And so ouch indicates there's some sort of dysfunction, and it doesn't say how severe it is, but there's some sort of dysfunction. And so this is where, if you're doing a proactive approach, you should be thinking about, okay, well, does anything call my name right now? Like I had my run, is anything calling my name right now? And if it does, then address it. Don't just like ignore it and go to bed and hope that it's better tomorrow. And then, the second part of that is don't just look where it hurts, because that might not be actually where it's coming from.
Right.
And so if you're doing it yourself, then, you think about some of the traditional things that people kind of do, like you mentioned stretching, right? Obviously, some sort of active dynamic warm up prior to activity, that's going to be a must. But if we're talking about static stretching, that's not actually the way most people dose it is not going to actually affect the fascia the way that they think it does.
Okay.
So let's go around the room and use this as an example. If you guys are doing your favorite stretch for your run, right? How long are you holding that stretch?
So if I'm being honest, less than 20 seconds for me.
Yeah.
That's
Phil.
I know it's wrong.
I've learned from you, and so I do my dynamic stretches before I work out. They're not, I don't do very much static things.
Yeah.
But even in general, even with the dynamic stuff, it's not enough. And I already know if I'm doing like a static stretch post-workout, unless I'm following what you told me to do, it's going to be like 30 seconds, 60 seconds at most to be kind of bored, I'm kind of bored in that stretch.
It's not fancy.
Yeah. I'm like 30 to 60 as well.
30 to 60. And so like most people, they'll get in their quick stretch post workout, right? If something's tweaked or it's part of their plan, they might talk about the 30 to 60 seconds. What ends up happening is, 10 seconds feels okay. By 30 seconds, maybe some of the uncomfortableness, the aches and pains, that starts to die away, right? At that time range, you're really just affecting the free nerve endings that are saying, oh, okay, this actually feels better. And so since it feels better, we stop. Plus, static stretching is kind of boring, right? But if you actually want to truly like deform the tissue and get the response you're looking for, you need to dose for at least like 2 minutes.
Okay.
2 minutes.
We just came through Thanksgiving, right? So I always use this as an example. So it's Thanksgiving week. You're stuck going to the store getting the turkey for the family, and there's 2 parking spots. One is right next to the handicap in the front. One's way in the back because everyone's at the store. Okay, so you buy the 30-pound turkey. They single bag it because they've run out of bags, right? And you're walking to your from the cash register to your car, parked in the front. That's the 30-second stretch.
Yeah.
But you walking all the way to the back, you're carrying 30-pound turkey, and by the time you get to your car, you're kind of cradling it underneath. The handle starts to stretch and deform. That's the effect that we're looking for when we're talking about dosing.
Okay.
So it's not that people aren't typically doing the wrong things. They're just not dosing it the right way.
And on that note, talking about it 2 minutes, can you explain the pails, rails situation? I kind of looked it up a little bit. I know you talk about it a lot, and that's kind of what you assigned for me for my current situation with a couple of things. So can you talk about what it is, the 2 minutes on, the time off, and then, the readdressing for another 30 to 60 after the initial 2 minutes? Kind of maybe talk about how that works and what exactly that does, specifically to the fascia.
Yeah. So this comes from the functional range conditioning world. The idea is we're still going to dose for the 2 minutes because we're looking to induce some sort of change, right? So 30 seconds is here. 2 minutes in theory is going to get you here, right, to create change. What ends up happening though is, let's say I had frozen shoulder and I had surgery and I'm immobilized for like 6 months, right? So for 6 months, I've never moved my arm past this range, but all of a sudden I do some, mobilization. I stretch it out for 2 minutes a day. I'm starting to get increased range over my head, right? But my brain has no concept, no idea how to actually control anything out here because it has no reference frame point for that. And so the Pales Rails really is meant to bridge that gap by inducing isometric contraction to start to build, a mind muscle memory motor control pattern so that if you ever get back here where you haven't been in a while, you actually start to develop true mobility. That's the difference between flexibility and mobility.
I was just about to ask. That sounds to me, after we had Dr. Matthew Brackney on a couple weeks ago, and we talked all about mobility and stability.
We went to school together.
And y'all have very similar approaches. I've learned a lot from each of you guys. And he talks a lot about the difference between mobility and flexibility.
Yeah.
And what you just mentioned, and I was going to ask, you already answered, but I was going to ask is that the difference? Because it sounds to me like the different flexibility says, yeah, I can get there.
Yep.
But mobility says, yeah, I can get there and I can perform.
I own it.
Yes.
Yeah.
Control it.
100%. And so in terms of, non-injured people, right? Like we should screen ourselves and figure out like where those deficits might exist so we can start to, work on those ourselves, right? But in the world of like recovering from an injury or, you're worried that something's going to cascade into a bigger injury, this is where, dedicated work towards that problem really comes into play.
And so we talked about stretching, or go ahead.
Well, I was just going to finish with the Pales Rails part, right?
Okay.
So Pales is progressive angular loading, and then Rails is regressive. So first we're opening up that range. Now what we're going to do is we're going to induce a contraction on both sides of the joint so that the brain understands how it's supposed to move on either side of that joint. And so, you guys might, scoff at the idea of isometric loading, but like, when you ramp it up, past a certain threshold, like it can be very demanding, and it's a very neurologically demanding, contraction. And so, all we're doing is we're training the body to be adaptable, to have better control. Don't freak out if you ever get into this space again. Now we have experience in this space.
Yeah. And so Pales, just a quick review, make sure everyone's understanding. Pales is the progressive part. So that's where the stretching part, right? And then the Rails, the second part of that is be the regressive part. So you go out of that stretch to the opposing direction.
Yeah. So and that's all we're doing. We're just building more and more range into that space. And so what we'll do is we'll typically think about dosing it for an initial round, right? An initial set. But realistically, you can do another set at a lower intensity and still capture like another 5 or 10% of range of motion, right? Like it's like trying to squeeze out just a little bit more out of the session before you move on to the next thing.
So in an ideal world, 2 minutes on, I guess it depends on the person, right? So this is not a prescription for anyone, but just to make sure everyone understands, 2 minutes on the stretch and then 30 seconds.
For you, 30 seconds.
Okay, yeah. See, this is not a prescription for anyone, but yeah.
Yeah. And this is where it's all case
Right.
specific, right? Because, someone might come in like, they just fell off a ladder and they're working through that same process, but 30 seconds might be too intense, right?
Okay.
50% isometric contraction might be too intense, right? The idea though is, it can be within any range that's missing, right? So it doesn't have to be point specific. And if you just understand the ideas, then you can apply it to other parts of your bodies too.
Right. Yeah. And so after you come off that, then you go back into it to get that extra 5 to 10%.
Yep.
Right. And then how does that compare to, we talk a lot about stretching. How does that compare to foam rolling?
So foam rolling is going to be really about that density. Okay. So remember we talked about the kinks in the fascia that start to develop, and the kinks, remember though, it's an environment for nerve endings that start to complain, right? The hyaluron that starts to get grumpy, it will complain too. And so the foam rolling is meant to address muscle density or tissue density. And part of that is fascia. Okay, so remember we talked about the cascade effect with the tempered glass. If you have that hot spot, so to speak, and you foam roll it, in theory, it's going to start to loosen up over time and get less sensitive, right? So that now it's more supple, and now it can move more freely in whatever direction it's trying to. And so I've seen a lot of different techniques for foam rolling. I'm happy people are trying it. I just don't think, again, like the consistency is really where I see where the problem is with foam rolling. Right? Like people will tell me, I'll foam roll. I say, okay, like when? And they'll say, well, like whenever it so-and-so flares up.
Yeah.
But the idea for us is like stay ahead of that curve before the flare up happens in the first place.
How much is enough?
There can be too much. And because what you're doing is almost like a controlled, you're breaking up that, the kinks, right? And so it's almost inducing a controlled inflammatory effect. And so you can have too much that will push you into the other threshold of like, oh, now it really hurts. Now it's inflamed, right? And so
sorry to interrupt, but now when you say, now it really hurts, you're meaning like too much at one time, or that's not necessarily too frequently.
No.
But it would be you're doing a particular muscle group for too long during one session.
Sure.
Okay.
Yeah. And like I had one guy who he had spent like an hour and a half, he told me, foam rolling glutes and quads and hams, right? And he came in, he could barely walk the next day.
So that's too much.
That's too much.
Yeah.
And I applauded him.
Just kind of hanging out over there. What is he doing? In an hour?
But yeah, he said he was watching the news and just going, just working on the foam roller.
Yeah, twerking on the foam roller.
But that would be too much, right?
Okay.
And everyone has a threshold or a cascade. But like the idea is we are going in and inducing some sort of change, which means that there's going to be some sort of inflammatory response.
Yeah. So we know an hour and a half is too much. 10 minutes on a particular body part, once a week, twice a week, 3 times a week.
So what I would say is pick a part, and I would at least plan for 5 minutes per region. Right.
Okay.
So if I'm working my quads, I'm going to work 5 minutes of this quad. Right. Even if it's, the only thing that's quote unquote calling my name, it's screaming out to me, I'm still going to spend the next 5 minutes working my other side. Right. Yep. Because I'm going to try and get symmetry or balance. Right. I know something is overloading this side, even though my left side is not complaining. The chances are there's some sort of overload going on too. And so we're going to try and balance that out.
And if I have a limited amount of time, so that's 10 minutes in total.
Sure.
Let's say I have 10 minutes a day. I'm already working out. I'm running. Obviously I have work, kids, all that kind of stuff. Is it okay to do it 5 minutes at a time once a week? And then tomorrow I do my hamstring. The next day I do my quad. The next day I do my lats, and then kind of start over.
So that's what we really promote. Just pick a problem and work a problem every single day.
Okay.
Even if nothing's hurting. Right. And I'd much rather have someone who does 3 minutes versus none, right? Or 3 minutes every single day versus I only do it the next time it flares up,
Yeah, and I know I'm asking you a lot of questions, but it was really just to kind of get to wrap up to this point that you actually taught me a long time ago that I've never forgotten.
Did I draw a picture for it?
I don't think you drew a picture in this situation, but if you would have, I definitely remember. So I'm going to say no, you didn't, but you explained it in a way because I was asking you these same questions. Obviously, not on. We were just talking, and you mentioned a list.
Yeah.
So you have a list of like whether it be past injuries, past things that have been an issue in the past.
Yeah.
You likely still have some type of small trauma from that. So you have a list. Yeah. For me, it would be like that right quad, right shin, right calf type of situation. So if nothing hurts, if I feel great, I'm still going to hit those things for my 5 minutes.
100%. So we're going to go like two versions of an extreme idea on that, right? I once, tweaked my elbow, like whenever I was walking my dog as a kid, right? That's a minor trauma that there was no, in theory, long-lasting change, right? The other extreme is I had surgery on my ankle. And so both of those things in turn may have healed properly, but post-injury, the body will move differently because of it. And so this is where, we take a full body approach when we are looking at problem solving in the office, but realistically, if, you have your list, then you're going to go into your own history and say, okay, what are the things that really stand out to me that like I never want to go through again, right? Mm-hmm. What are the things that constantly come up that I'm having to tweak and fix? And then all you're going to do is you're going to prioritize it. And so, for me, I've had right ankle surgery. So guess what I think about? Right lower leg, right? That's going to be top of my list. And then everything else is going to fall underneath that the way I rank it. So if I'm completely healthy, nothing's hurting, I'm going to work on something that's going to affect my ankle, right? And then the next day I'm going to work on something that's going to affect, my thigh, because it's going to be leading in the same area towards my ankle that I had surgery on. But then if tomorrow I tweak, my wrist, then that's going to be the priority until it quiets down again, right? So you're constantly like working on something, but you're doing it in a systematic way to where nothing's, getting ignored.
Yeah. And you're also not spending like your whole life, an hour and a half on any one thing. You're just kind of rolling through your punches.
Yep.
Okay, cool. Well, we kind of move on, but do you guys have any questions on foam rolling?
Man, he nailed it.
Yeah, I'm chilling.
Okay. All right, cool. I guess so. Let's
percussors, same idea.
Oh yeah.
Percussor, I see people use it. They're just not consistent with it. And they're not thinking about the big picture. So, a lot of times they'll say, well, I'm working on my hip, but I didn't realize that this thing in my lower leg was a problem, right? Mm-hmm. So don't just focus on, where it's obviously hurting you. Start to really think and explore where else it might be connected, and work away from that.
Any advantage to percussion guns over a foam roller? Let's say someone's like on a budget and they're like, I got to get one of these things or the other. Obviously, percussion guns cost more. Foam rollers are really cheap and easy to find,
So it depends on the client, but realistically we use foam rollers. Honestly, I give lacrosse balls to people all the time. Mm-hmm. So that's our go-to tool because it's you can use it in so many more different spaces and contexts, right? But for percussor, I would tell you, one, you can get a family member to help you tweak some of the other parts that, you might not be able to reach or work on with a foam roller. And then two, it allows you more freedom to actually focus on, any one particular hotspot that maybe it'd be uncomfortable to use a foam roller on. Yeah.
Actually, Dr. Brackney did teach me this. He said the cool thing about percussion guns is that you can, or foam rolling and percussion guns either way, doing a similar thing. But if you can stretch a muscle while you do it, the effectiveness kind of goes up a little bit. And so the cool thing about percussion guns is you can hold a stretch, and then a third party can come in and hit you with a percussion gun while you're stretching. Like say your outer hip or your glute or something, you kind of do a stretch and then someone does it.
Well, same idea though with it doesn't just have to be static though, right? You can dynamically be moving while you're using the percussor.
I've never seen that.
Yeah, I've seen that.
And so
like hip mobility and stuff like that. I've seen.
You can use anatomy anatomy as your guide and just say, okay, well, I know this joint's supposed to move a certain way, so I'm going to move it while I'm hitting up the tissues.
So like a leg
support it.
extension as I'm using the percussion gun on my quad.
Yep.
Wow. Never thought about it.
Yeah. And, just think about, the percussor is basically going to, be the self-maintenance so that you don't have to pay someone like me to use my hands or my needle to do it for you.
Oh, yeah, sure.
That makes sense?
Yeah, it does. And that's kind of a perfect segue into the next thing we were going to talk about is, let's say foam rolling or percussion gun, someone's doing it and it's not working for them and they decide to reach out to someone like yourself.
Yeah.
Like what kind of techniques are you using in the office to help with fascial adhesions or, muscle issues in general?
Yeah, so a couple of things is... our whole mindset is based off of the FM model, fascial manipulation by Stecco. It's absolutely amazing. It will change the way that you think about your body. I encourage you guys I tell all my patients and clients the same thing. Like, go buy this book. You don't have to have a deep, understanding of science because there's plenty of slides that kind of break down the ideas and concepts. I accidentally bought one that was in Italian, and I still kept it while I waited for my English one to come in.
Okay.
Because the idea, though, is, if you needed manual therapy, then we do the FM model. And so that's basically we will take a look at a problem for a whole body approach. And the idea is we're trying to create an ideal movement environment to resolve issues. And so under the FM model, they basically break down the body into X amount of segments, and at every segment, there are 6 points of coordination. They're called CCs. And so at any of these CCs, this is where through research and years and years of work, they've figured out or theorized that these are the points where lines of stress intersect in the body, right? And so if you go and assess the CC and it's moving freely and it's not painful, then guess what? There's freedom of movement at that CC. But if you go and assess the CC in that segment of the body and it says ouch, right? It does not have bounce or give and it says ouch, that's dysfunction. And so, going back to don't just focus on what, seems like the obvious elephant in the room. They take a full body approach and they try and map out not just where the problem is, but what the framework leading up to that problem is. Yeah. And then, you can use manual therapy with your hands to address those or dry needling, right?
Mm-hmm. And speaking of, I have a specific question about dry needling, and then I wanted to mention something else. With dry needling, and we talked to Dr. Katie Van Wagenen. I don't know if you're familiar with her, but we talked for an hour and a half all about dry needling, and until we actually did it yesterday, and people have been asking me about it. And I've kind of explained it, and definitely this, if I sound stupid when I say this, it's okay. You can tell me, but someone was asking about it and they're asking me questions like, man, I don't really know how to answer this question, but they were like, how is it kind of like, how does it feel? And I was like, well, consider, manual therapy, like a massage, like comparing it to a massage. I was like, think about getting a massage from the inside.
Yeah.
Is that, am I even on the right track, or is that just completely idiotic?
Yeah, no. Like you're on point, because this is why, again, we always promote, even when people are done with their care plan with us, we always promote like self-reliance. Like don't rely on me. Don't rely on anyone else. Rely on yourself. Take care of yourself. Come back and see us if and when like you reach a point where you can't, right? See us for the next big thing. But what'll end up happening is if you foam roll and you use the percussor, you are influencing all those different layers that we talked about, right? You're trying to create a good work environment for your body. The difference is if you get a professional to do it, we're going to be more targeted with where we're working versus just kind of shotgun approach. The other thing is we're going to focus more on depth, right? And so something like massage is going to be superficial for sure, right? That's why it feels so good, right? It's superficial layers being affected. You're not impacting any of the deep layers.
Like the outermost layer. And we talked about at the very beginning, fascia is multi-layered.
Multi-layered, right? Like, so you got skin, adipose tissues, 2 layers superficial fascia, 3 layers of deep fascia, right? And then muscle, right? So when you're getting a massage, it's going to affect the superficial layers. If you're going to do cupping, it's going to affect the superficial layers, superficial layer of fascia too, right? But if you're doing manual therapy, now we're getting deep to
and when you say manual therapy, like if you're looking on a camera right now, you see Frank's got his thumb, like a thumbs down, like digging in kind of thing. But can you define manual therapy for us?
Well, manual therapy is where we're going to use our hands to target tissues to make them move better, right? During the healing process, during recovery. And so, the idea for us is, we're going to sink to depth. That way we can influence that tissue as best as possible. And then from there, we might induce, like we do, some sort of motion, right? That way we can kind of work through that whole line of stress. My thumb is awesome to reach those spots and sink to depth, right? But it's still a very broad surface area versus I have a needle that's very pinpoint all the way down where we know we're trying to target. And then that needle is kind of like you said, it feels like kind of getting a massage on the inside, right? It's because it's trying to affect, all those different layers of tissue, but at its deepest layer. And, the needle itself is kind of misleading because it's, it's a sterile, really thin needle, right? Length is different depending on body part, but it's influencing not just where the needle is, but everything around that needle, right? So it's actually, in 3D space, it's creating that kind of controlled breakup that we're looking for. That way the body starts to heal through inflammation. And, this is where in a rehab, prehab kind of situation, you're trying to induce good movement pattern behaviors through your homework while your body's healing so that it will function better long-term.
Knee to hip was like, shaking and pulsing, right? Even though you had this little, I don't know how what's the diameter on these things? Do you know?
Oh, it's super small.
Yeah,
super small.
Tiny.
And the needles I used were like 2 inches. And so I probably had like an inch and a half.
Oh my goodness. Yeah. And like that's what I mentioned earlier is when he's pulling them out, like you can feel that depth, but on the way in, you can't feel the depth.
Yeah. You know what we ought to do when you come record? We ought to get a close up view when we insert and when we release the needle, because we might even see like, sometimes you can see the fascia is so angry that it'll grip onto that needle.
Really?
And so you'll see like a tenting effect as you're pulling through. Yeah,
Wow.
There's been a couple of times where I wouldn't say like a needle got stuck, right? But it's like it's just so tight, and the patient is just kind of like on edge. They're anxious, right? And it's like, okay, like let's pull this other needle first, and then we'll come back to this one and last.
And is that something that you just kind of gotten with experience on like how to kind of figure that out, or?
Yeah, I mean, when we're removing needles, it's always systematic. So, we can make sure we're keeping track of what needle is where, right? We're not leaving anything behind. But yeah, like the reality is you're going to get feedback from whoever you're working with. That way they're comfortable.
Is that something that eventually will like loosen up, or is that like you had one patient that always just has this super difficult to work with fascia?
It will loosen up.
Oh, okay.
Yeah,
gotcha.
yeah.
So it's not a permanent thing.
Nah.
Okay.
Another thing with using a professional that I've noticed, and I've had only one, I guess, major injury. Well, I've torn both of, I don't know about tear, but I've blown out both of my hamstrings in the past. But a few years ago, I hurt my back pretty bad. And I went to an Orasti place. Are you familiar with Orasti?
Yes.
Okay. Yeah. I went there and I had this real bad low back. It was actually a lumbar strain. I don't know if I've told you this, or I'm sure.
I don't remember an Orasti story.
Oh, okay, yeah. Well, Orasti, I had done all kinds. I had done cupping. I never did needling at this. And this was like 6 years ago. This was about 6 years ago. And this is when I learned that the most important thing when you're working with a real professional like yourself or anyone is actually figuring out what's going on in the full body. You mentioned the full body approach, and that's kind of what I want to cover here is when I went to Orasti and I had this low back pain, not only was he working on like my hip and stuff, which I imagined, but it was like a lot of quad work as well, and a lot abdominal.
Yeah.
And then I noticed that yesterday as well when I went to your place and we were talking about my toe and my shin splint.
Yeah.
We did some abdominal work as well.
Yeah.
So I don't know if there's anything in particular. I don't have a particular question, but I think that a big thing here is if you're experiencing pain and you're doing all this stuff and you can't figure out what it's going on, it talking to someone that actually knows how the body talks to each other, like how the fascia, I guess, is all connected, is just so valuable. Like the actual diagnosis of, my back hurts, or I have this shin splint, but it's not my shin, it's not my back. It's something else.
Well, that's the thing, right? Like you could go into an office with any clinician and say, hey, like this hurts, right? They say, oh, okay, you have low back strain, right? But the idea, if you don't have a clear mechanism of injury, is like, why does it hurt in the first place? Or why does this thing keep coming up, right? And so, it's funny that you were talking about like, your toes. If you just think about, the self-maintenance at home, you need to be thinking about planes of motion too, right? So if you know that, my hamstrings are constantly, under stress and duress, and this is part of my problem list, you should be thinking in 3D space for plane of motion, because hamstrings are going to influence a lot of that posterior retro motion, right? Like when we're running, but it's also going to be in the sagittal plane for, the quads, right? And so this is why, we might take a look at working front to back, or, from one side versus the other, because these things are tied in, they're coupled motion. And then under the FM model, it is very much like, hey, like that toe might be influencing what's going on upstream.
Mm-hmm. And when it comes to, are there any specific principles that you're keeping in mind as you're assessing a situation like that? You mentioned, I know you just said front to back and things like that, but from the how the fascia is connected in general, are there any specific principles that you're kind of always keeping in mind, connecting point A to point B or anything like that?
Well, for us, we need to frame out what our workspace is. And so that's where like part of the evaluation is not just palpating where someone is saying it hurts, but, chasing it down, right?
When you say palpating, what exactly
like we're looking for trouble spots, right? Mm-hmm. And so we'll do that a couple of different ways. We'll either feel what muscle and fascia are, how you're responding to that, or we'll load it, right? And so this is where we'll do those table tests, and we'll see like, okay, how does that feel to you when we do this, right? Is it strong? Does it hurt? Is it kind of a combination of both? But the idea though is, the principles are we're going to chase down not just where someone is complaining about, but we're going to frame out like how big or how small this problem is. Now we have our workspace. And then typically what we'll do is we'll think about working from outside to in. And then not only outside to in, but we'll think about influencing balance. And so this is where I was talking about like planes of motion, right? Like, if something is constantly hurting in the front, spend some time working that out for sure, but don't ignore something else that might be influencing it in the back.
Mm-hmm. And so if you're feeling around, well, somebody says they have a particular issue, you're feeling around, obviously that hurts. And then are you just kind of randomly going to other places, or do you know what things are kind of connected to each other?
Yeah. I mean, that's where like the FM stuff comes in. Mm. That's where clinical experience comes in. That's where, what's funny is whenever I went to school, like, they didn't teach me, jack about, being a business person.
Oh, sure. Yeah.
And, they really like, in retrospect, like I just remember, the idea of fascia was just a throwaway topic, right? Like you kind of knew what it was, but you cut it away and you moved on to the next thing, and you're studying the other stuff for an exam, right? So it was all like, all passion project basically of like educating myself and finding the right people to learn from, so that I can make sense of like how to help someone.
Okay.
Yeah, because that always drove me crazy, because I'd been a patient before too, and it's like, well, yeah, like I understand my knee hurts, but like, why does it hurt in the first place, right? Mm-hmm. It's stable. There's no tear. Like, why does it hurt in the first place? Mm-hmm. And so that's what led me down, like chasing down this whole rabbit hole of fascia.
Yeah. So to quick overview, you find the issue, with the professional's experience, you kind of go outside, right? And you find the other areas, you kind of start on those, and then you work. And then maybe by the time you get to the problem point, maybe it's relieved.
Right.
at that point.
Yeah,
Is that accurate?
yeah, that's the idea with, intercession. We're expecting things are improving. You're moving better. We can load those better, right, to fill in the gaps. And so in theory, like over the course of like care, that window, that framework is going to become smaller and smaller. The intensity is going to be reduced. And then, you would expect like someone's going to perform better, right? They're like, hey, it doesn't hurt whenever I'm doing this anymore, right? So, but the idea though is, if where it hurts is like the center of gravity for that problem, by working on the ends and balancing it out, we're kind of unkinking the chain so that coming towards it.
Yeah.
Yep.
Yeah, that's how I was viewing it as well. Like, it's like, say we draw a circle here, right? Frank, I just wish I had your whiteboard, man. We have a circle, right? The problem's in the middle. We work from the outside of the circle, slowly but surely stepping forward toward, and by the time we get to the middle, maybe your problem's even resolved.
Right.
Possibly.
Right. And so, yeah, we like 100%, like our mantra is like all the pieces matter.
Yes.
And so it's like, we will talk about old injuries, but we will look at areas where it might not make sense on, on an obvious standpoint.
From a surface level perspective,
right.
Yeah,
you're like, hey, like I'm coming in talking about right elbow pain. Why are you looking at my left shoulder?
Yeah,
right?
yeah.
But it's like we're looking for like why is this influencing each other?
Yeah, I think it's important to keep that in mind. Because we started this whole conversation with like, what is fascia?
Yeah,
it's this huge thing that covers your entire body, and they are all connected. And maybe one way to think about it is, you have this giant spider web. Imagine you have a spider web that's covering your front door, and I snip a little piece in the upper right corner. Well, the lower left and somewhere in the middle and the upper left, they're all going to get affected by that, because it's this spider web that's all connected.
Yep. And it's not just influencing lines of stress, but again, like we're thinking about what is the healthy environment for everything else that exists in the fascia, right? The nerves, the blood vessels, the capillaries, the lymphatics, right? The muscles. Like, so it's the idea is we're creating a great work environment for everything to function.
Yeah. And, man, that's kind of scary to think that if you're, and not to scare anyone, but you just list out a lot of very important things within our body.
Yeah.
And what you're saying is that unhealthy fascia can lead to
principles, right? Of, unhealthy fascia can have a negative effect on surrounding tissues. That's like a no-brainer. And so, a lot of times people are coming in and they're doing the right things, but they're just not dosing it the right way to create a good work environment.
Yeah, because foam rolling's pretty simple, but what you're saying is you got to do it consistently enough.
I think they just need a better framework, consistency, and then just thinking about the body, right? Like thinking about the body in a different way, right?
Yeah.
Like don't just hit where it hurts. Like think about above and below the problem, and then maybe if it's even behind, because we're thinking about 3D space.
Yeah, I have a terrible habit of that myself. I'm just focusing on only where it hurts versus all around it.
Sure.
Yeah.
Super cool. Frank, you've said it a couple of times. Let's get into fascial manipulation.
Yeah.
How it started, where it came from, and then principles, I guess, on how it works.
Yeah. So
this is I'm interested in all of this, but this is something I'm kind of been waiting for.
So this is from the Stecco Institute in Italy. There's only a handful of practitioners trained in the States to teach it. So I learned this under my own like nerdy like rabbit hole, right? But I ended up getting trained under it through Sue Falsone's Structure and Function Continuing Ed. And so the Stecco method basically started off over in the 70s. Luigi Stecco was like this clinician who also spent so much time in the lab doing research. And what did he research was fascia. Okay, that was his passion project. And he was interested in the idea of like, why is it important and how can it help, in a clinical perspective to help, patients, right? So he was on like the forefront of like all the things that we talked about. And so what ended up happening is under that method, through years and years of research and experience, they basically broke down the body into base components. And at each component, they realized, hey, like these lines of stress are converging at these points over and over again. And what's funny is like when you look at dry needling courses or you look at acupuncture courses, there's a lot of overlap for the same areas, but they just call it different things for different reasons, right? And so they're not 100% one-to-one match, but there is a lot of overlap.
Pretty close.
And so what ended up happening is, and I've even watched a video of this guy like dissecting a rabbit in the field, and he was dissecting a rabbit in the field, and going through fascia, right? Like dissecting out the fascia just because he loved it, right? So in come the kids, Antonio and Carla. And they basically took up the reins whenever he stepped away, and they have been running the show since. And so Carla is the one who's in the lab, and they're the ones doing dissections and research and that point of it. And then Antonio is the one who's going around the world teaching people how to do the clinical side of it.
Super cool.
Yeah. So it's definitely a family affair.
Yeah. It's really cool that his kids kind of picked it up, whenever I'm guessing he got old and decided to retire.
Sure.
And they said, no, we're going to keep this thing going.
Yeah.
And that's why we're hearing about it now. I like that.
Yeah. But, the idea behind it is, it just gives a baseline perspective on where else to look in the body. Mm-hmm. And then, of course, they have their own methodology. Like we've kind of touched base on some of it, like don't just go for the obvious, but, think bigger picture. And then, from there, they do have their own different, quote unquote, like set of principles of, maybe how to rehab that problem. Mm-hmm. But this is where like being a clinician gives you the leeway to figure out like, oh, I want to do it this way versus that.
Right. Super cool, man. Well, if people are having some issues, where can they get a hold of you, Frank? What's the best way to get in to see Mr. Frank and get some professional help if you're having some of these issues?
Usually people call first. If they're interested, they can always sign up for a free discovery call. Mm-hmm. What I found was people will sign up for a discovery call, and they really liked whenever I'd offered them a Zoom.
Yeah.
Nice.
Because then we can just like look at each other face to face and have a conversation. And that's really like an opportunity for someone to share their story, and then just us figure out like, hey, am I a right fit for you, or is there someone else I can point you to?
Right. And that's just a number they can call?
Yeah. You want me to give my number?
Yeah, sure.
Yeah. They can reach me
them
at
digits, man.
281-800-5047. If they want to, they can always go on the website and book. That's rebelmobilityfitness.com.
Rebelmobilityfitness.com.
Yeah, or if they want to email me, then they can email at rebelmobilityfitness@gmail.com.
Okay, man. I love it. People get a hold of Frank, and hold your stretches for longer than 10 seconds. All right.
Overarching takeaways.
Yeah.
Right.
Stretch longer.
10 seconds
Man,
ain't gonna cut it.
I love every part of this. Frank, thanks for coming on again, man. I don't know if we mentioned it. You're a repeat guest, and anybody who's been watching would know. Mm-hmm. But man, this one was like Phil. I started off thinking that fascia and muscle fascia was one word in my
yes, that's a great way to put it.
It was a phrase, like it was a thing.
It's like Velcro. Yeah. Everything's just Velcro, man.
I'm glad. But anybody else got anything before we close this thing out?
I did have a question.
Sure.
Does you know how people will develop a I call it crunchy joints,
Sure.
Does that have anything to do with fascia, and how can you kind of like remedy that,
Yeah. So again, if we're thinking about fascia, we're thinking about lines of stress, mm-hmm. and those lines of stress are going to cross the body at joints, okay. Right? And so crunchy joints probably implies like too much pressure at that joint, creating whatever crunch you feel, right? Okay. So again, it may or may not come into play that it's an articulation problem, where it's a joint moving on a joint problem, mm-hmm. right? Yeah. But if the joint is clear and it's moving freely, then that's where I would be thinking about connective tissue, fascia specifically, and how stress above and below, like the joint, the elbow is where it's crunchy. That's mm-hmm. where it's complaining. Mm-hmm. Doesn't mean it's it's the root cause.
Okay.
Right.
Could be like
And
the
so
tricep.
This
or
is
the
where we're
shoulder.
looking at the shoulder. We might go into the head. We might go into the hand.
Really?
Right. And so this is where like the professional help comes in. Right. But you know, again, like we're just big proponents on do it yourself. Right.
Yeah.
Be self-sufficient. You know, the reason I was super excited to come in and share with you guys is because like that's the idea. Like just get people to do things more consistently, but then also think about their bodies in a different way than what they probably have been doing.
That's the big thing, I think, because for sure people are like, oh, my elbow joint, like what's going on with my elbow? But from what you're saying is we need to look above it. We need to look below it. We need to look behind it.
Yep.
And so that's thinking about your body from a different perspective.
Yeah.
We're coming from a different angle. We're going to try these things. And then when you do it yourself, I'm like, try things, like actually try
Yeah.
and for a consistent amount of time. Don't try it today and say it didn't work tomorrow.
Right.
Because we've all done that. Right. But, you know, try it for a consistent amount of time, maybe a couple weeks or something.
Yeah. So like whenever I've done workshops, I always finish by asking people like, just give me 2 weeks, be consistent with it for 2 weeks, and then come back and tell me like it didn't help you in some way, shape, or form. Because you know the idea is like just get them to be on program and be responsible for their own well-being, and they will notice a difference. And
So if you have anything going on, 2 weeks, above, below, in front, behind.
Yep.
Inside, outside, upside down.
Yep.
Left,
Take
right,
control.
center.
Yeah.
Take control.
That's what I'm getting out of this.
Yeah.
Last little tidbit is take control of your own health, and there are professionals like Frank to help you out at rebelmobilityfitness.com.
Yeah. And what I've noticed is by doing that, I am more motivated to stay in control because I know I know exactly what to do is to have the confidence to know that I'm doing the right things and I'm not wasting my time.
Sure.
Because some of the stuff, like, it's kind of boring. You know, like we talked about this earlier, right?
Yeah, but that's the part of it, right?
Yeah.
Like if you are gonna live, the greatest version of yourself and basically be as functional and as active as you want to be, that means you have to put in the maintenance, right? Like I tell people this all the time, like, dude, like you're a freaking Ferrari driving around with the handbrake on.
Yeah.
Right. Like you need to check the tire pressure. You need to check the fluid. You need to get it detailed for the weekend. Right. Like you can't just, drive all weekend long and ignore it during the rest of the week.
Yeah, I think Sean likes to consider himself a Porsche.
Yeah.
Porsche?
Sean's like a Porsche.
What kind of car would you consider yourself?
A Tesla truck.
Nice. Okay.
Very nice.
What about you, Daryl?
Man, you know what, dude? I don't even know. I don't know what I am. I'm thinking like a 1970 Chevelle SS.
That's pretty sick.
I like it.
I like it.
Yeah.
Pretty specific, right?
Very strong, powerful, American.
Strong, powerful, very American. Yeah.
That's what I'm saying. American. So,
Yeah,
guys,
loud and rowdy.
we got to get loud and rowdy. We got to close this thing out because I need to go stretch. And I'm gonna be holding it for 2 minutes. Frank, thanks for coming on, man. And y'all be sure to like, subscribe, tell your friends. And until the next time, we're out.